Today's education session will be on exercise. We're going to discuss its roles and benefits for those with lung conditions, along with barriers to exercise. It was once said, if exercise could be packed in a pill, it would be the single most widely prescribed and beneficial medicine in the nation. There are three components of physical fitness: endurance, strength, and flexibility. Today we're going to focus on endurance and strength. The purpose of strength training is to build strength of skeletal muscles and support joints. It has high intensity with a focus on repetitions. Frequency is usually 2 to 3 days per week, but not 2 days in a row. Types of examples of strength training would include push-ups, abdominal crunches, weightlifting, resistant bands, or core exercise. The benefit of endurance exercise is to improve the ability to maintain activity over a period of time. It targets the heart, lungs, and circulatory systems. Its focus is on duration, 30 minutes once a day, including a 5-minute warm-up and a 5-minute cool-down. We would encourage 5 to 7 days a week to improve and 3 to 4 days to maintain. Some examples of endurance exercise include walking indoors or outdoors, treadmill, biking, and swimming. Many people ask about the benefits of exercise. So for our pulmonary patients, besides the improvement of ability to maintain activity over a period of time, other areas of benefits include feeling better, having more energy, decreased resting heart rate, decreased blood pressures, decrease weight, improve circulation, improve endurance, increase muscle mass. Other benefits of endurance exercise include improved sleep, better cognitive abilities, better bone health and joint health. There has also been shown a risk reduction for other chronic illnesses, such as stroke, dementia, Alzheimer's, depression, cancer, and disability. We always want to be mindful of signs and symptoms of overexertion. Cardiac signs and symptoms to be aware of include fatigue, shortness of breath, lower back pain, right arm pain, left arm pain, tightness in the throat, red rash on the left arm, jaw pain, chest pressure, nausea, lightheadedness, feeling of cold and clammy sweat, irregular heartbeat. If you have symptoms, you should always modify your activity until you are symptom-free, thus pace yourself. Use pursed lip breathing techniques, take nitroglycerin if it's been prescribed, and notify your physician of any new symptoms or change in symptoms. The benefits of strength exercise include increases in muscle strength, tone, and exercise, increases in metabolism, improves our skeletal stability, thus our balance and coordination will improve, as well as our posture. Strength training helps protect our bone health and muscle mass by increasing bone density. It also plays a role in disease prevention, as it can decrease pain from arthritis, improve glucose control, and help us prevent injuries. Strength training is known to boost our energy level and improve our overall mood. The rating of perceived exertion scale, as shown here, is a way to describe how hard you feel your body is working. We do encourage you to stay within the 12 to 13 scale, not too bad, somewhat hard. If you find that you are able to exercise much longer than a 30-minute window and remaining in that scale of not too bad to somewhat hard, you may find that you want to increase your workload for that activity level. Our rating of perceived breathlessness scale, as shown here, is a way for you to describe your shortness of breath while you are doing an activity. We encourage you to stay within the 11 to 13 range, fairly easy, not too bad, to somewhat short of breath. If you find that you are going much higher than that on this scale, then you would want to readjust your activity level, readjust your pacing, and or readjust the type of exercise that you are doing to bring you back to the 11, 12 to 13 scale. One way to think of the rate of perceived exertion and rate of perceived breathlessness scale is to answer the question, how hard is it to keep going with your activity, to keep you within that 11 to 13 range? If you are breathing heavier but still able to talk, and you do not have any struggle to complete your sentence, but it would feel good if you were able to quit, then you are probably in that 11 to 13 range. As we monitor you and follow you through your pulmonary rehab sessions, we do look at your aerobic exercise progression. One way that we note how this is changing for you is that we look at your highest MET level that you record each time that you are here, and how long you were able to sustain that certain height of MET level. We do a 30-day update of your individual treatment plan where we assess your independent exercise habits, your return to functional goals that you have set, the education that you have completed within our program, and if you've achieved the MET level that seems to satisfy the ideas and activities that you want to achieve on a day-to-day basis, then that is how we assume that you are reaching your exercise potential. Metabolic equivalents, or METs, are a unit that compares the amount of oxygen it takes to do any activity to oxygen use at rest. At rest is known to be 1 MET level. Any increase in activity above resting levels results in a higher MET value. For example, if you are walking on a treadmill and the display shows that you are at 3 METs, you are working 3 times harder than you were at rest. You are also using 3 times more oxygen and burning 3 times as many calories. How do we measure your MET level goal? We ask you what types of activities that you want to resume in your day-to-day life. These activities typically have a certain MET category associated with them. So that would be one avenue that we would look towards as far as what your MET level goals should be. We also look at your overall health goals and any coexisting medical conditions you may have. Obstacles to home exercise may include boredom. Here we suggest that you vary the setting or the activity, alternating lighter and longer workouts with shorter, more intense ones. If time is an issue for you, we would suggest scheduling it as you would for any appointment. Set it as a priority and make exercise part of your routine self-care. Always have a plan B when we have weather, and then make sure that your exercise provides some joy to you. Perfectionism can be trouble. We would encourage you to be firm but not unrealistic with yourself. Non-cardiac pain certainly can be an obstacle to home exercise. Pain, such as with arthritis, may be unavoidable. Pain levels should be back to baseline within 2 hours. It may be something that you have to consider adjusting your activity if that doesn't happen for you. Progress your exercise gradually. Focus on tapering if you need to. Also think about frequency, then duration, and then intensity. And vary activity to minimize repetitive stresses. Use good shoes. You may try trekking poles, canes, walkers, shopping carts for upper extremity support. And you can also consider non-weight bearing activities that are seated or pool activities.